Swift is a method that we use in clinic for the treatment of verrucas. It's a fairly new technology. It's been around for about 4 years. I've had my machine for about 3. It is a method that uses microwave therapy to treat the skin that is infected by the verruca. So this is the machine. I'm just going to turn it on so you can see the noise it makes. It has lots of nice lights and things. We use a probe with the Swift to get the microwaves into the tissue. Every time you use the probe on a new patient, we apply a little head to it. So they go on the top, and then the patient is sat in the chair. We usually take some of the callus off the top of the verruca, some of the hard skin, and remove that, and then the probe is applied to the skin. Press a little button, it makes a couple of little beeping sounds, and it sends out a jet of microwaves into the tissue. I'll just turn this off, it's a little bit noisy. So the microwaves go into the skin tissue. They superheat the tissue in that area, which causes a little bit of cell damage. The idea is that we are letting your body, letting your immune system know that there is a problem in that area. Verrucas are stubborn little things, and your own body has a hard time getting rid of them. It doesn't always realise they're there. So the microwaves in the Swift go into the tissue, superheat the tissue, and let your body know something is going wrong. The research shows that you do Swift over 3 treatments. So you do day 1, you do it 4 weeks later, and then you do it 4 weeks after that. So you have to hit it with 3 lots of treatment, and then you wait 12 weeks and review to see how it's looking, and hopefully your verrucas have gone. The reason we do them at the 4-week intervals is that's about the time that it takes for skin cell renewal to happen, about 3 to 4 weeks. So you zap with the microwave, it causes the cell damage, the body gets everything to it to repair it, and then we hit it again just as it's repairing, and then we hit it again. And evidence-based research has shown that that is the best way to treat it. Sometimes, if it's not totally worked after 3 treatments, we do go on and do a 4th and sometimes a 5th treatment, which prove really quite successful. Now, the upsides of Swift are it's a quick and easy treatment. It doesn't require you to have any dressings, no acids, no plasters. You can go swimming, you can do sports after it. It's not usually too painful afterwards. It can be a little bit tender on the day of the treatment, but you know, I've had people do 10k runs a day or 2 after they've had Swift treatment without any problem at all. The downside to it is that when you're actually treating it, when you're actually doing the little zaps of microwave, they do sting a little bit. They do make you grit your teeth. And each site has to be treated 5 times on each treatment time. So depending on how many verrucas you've got, depends on how many zaps of the Swift machine that you have. And so I would say that most people say it's quite an uncomfortable sensation for that 2 seconds, but it is only for those 2 seconds and it goes off after that. So the way we cope with it in clinic is we have a little stress ball that you can squeeze when it's zapped, and we do some nice yoga breathing to get you through it. But most people seem to cope with it pretty well. It sounds worse than it is, but it's pretty good. So we've had a lot of success with the Swift machine. Research shows that it is 76.6% effective in getting rid of verrucas, and I would probably agree with that. About 3/4 of them clear up with the course of treatment. So this was me today, just wanting to give you a little look at the Swift machine and tell you about what it does and the success that we've had.